Hello students! The purpose of this brief video is going to be to provide a pre-briefing for your preclinical OSCE. As a reminder, the preclinical OSCE is happening here on the very first day of our fall semester. And included with this email will be this SBAR report. So you'll notice here that you have your situation, your background, your assessment, and recommendation. And you'll see here what your provider orders are. Those are the expectations of things you will implement during our OSCE experience. And I just kind of wanted to walk through the expectations here for you. Just as a reminder, the preclinical OSCE is considered a summative OSCE, meaning that you do need to pass this OSCE prior to the start of your clinical experience. So please consider that as you consider your practice time prior to our date and time of our OSCE, which is 8/25. What to bring on the day of the OSCE? Please bring a watch with a second hand. Please bring a writing utensil. Bring your stethoscope. And bring your skills lab bag with supplies, and make sure you have a pen light. We ask that you do wear your USF scrubs and your name tag for this experience. The checklists for each of the skills and assessments that you'll be completing as part of your OSCE have been emailed to you, so you should know exactly what is expected of you from that. Keep in mind that if you need to review a video related to one of those skills, they would all be housed within your ATI skills modules. Once the OSCE is complete, we will have you return to the classroom side to receive your checklists back. And we ask then that you will take pictures of those returned checklists and upload all of those checklists to the learning management system under OSCE documentation. For my junior traditional students, those OSCE drop boxes will be housed within your medical surgical nursing course. And for senior traditional and accelerated students, these will be housed within your pediatric nursing course. They are due by 7 p.m. on the day of our OSCE, so please take care of that as soon as you are finished with your evaluation and have those sheets back. So the stations that we will have for you in the OSCE, we're going to have 2 different stations for 2 students to be doing this at the same time. So we do have 2 circuits running simultaneously. So you will be doing a straight catheter. Our next set of stations will have 2 stations, which are peer-to-peer checkoffs. And you'll see here we're going to have stations, I'm just going to scroll down here, 2 and 3. For the person that came into station 1, and stations 8 and 9 for the person that started with station 7. And you'll see here that it's very specific. We did reverse this. We're going to have peripheral IV starts right here in the center and our secondary IVs off to the side, just so the timer can help the peripheral IV start people just a little bit more. But please do notice that when you're in the student skill section, then you are actually doing the skill and being evaluated. When you are in the evaluator spot, you are the person evaluating the person doing the skill. So please pay attention to that, and you have 10 minutes for each of those stations with 1-minute transition, the same as all of the rest. We then also have 1 station, so our people that have done stations 1, 2, and 3 will proceed to station 4 and do a cardiac and respiratory assessment on Apollo with a faculty member to evaluate that. And then again, the last set of stations is again going to be, you're going to be in the student skill, you're going to actually hang the secondary IV piggyback. And if you are in the 6th spot, you are going to be evaluating the student doing the IV piggyback. We are also going to have you calculate the rate in mLs per hour that you would infuse your IV piggyback. So you don't need to use the drip factor on the package or anything like that. We just want to know how many mils per hour you would set your pump at in order to infuse that antibiotic in the appropriate amount of time. Okay. So everyone's going to be starting in a different spot. Okay, so if you start in 9, you're going to proceed to 10, 11, 12, and then come back to 7 and 8. So again, it's going to be very important that you know whether you're in the student skills section or you're in the evaluator section for those peer evaluations. After that, you'll exit JESCI through the stairs. We do then want you to come back around to JESCI 205. Following that, you'll need to drop off your bucket so that the next set of students coming in can utilize that bucket for their supplies. And you will stay there until you get your completed checklists back from your evaluators in order so that you can get those uploaded to the learning management system prior to the due date at 7 p.m. So you'll see here the schedule. You'll notice everybody has signed up for a time. And so you will just follow the order of the numbers as they are here next to your name. I would recommend that you arrive no later than 15 minutes prior to your scheduled time because you will need to assemble your supplies. We have them all laid out for you. Although we ask you to bring your skills bag, we will have fresh supplies for you. You will also need to allow for about 15 minutes on the back side so that your evaluators can finish their notes and return those back to you. Just a quick look here at the checklists. Again, these have all been emailed to you. So you will not need to prime the primary tubing. That has already been primed for you. What you will be doing is hanging the secondary. So you will be back priming and hanging your secondary and then calculating the rate. And again, that's going to be a peer-to-peer evaluation. The straight cath, again, your checklist is here for you. This one will be evaluated by a faculty member. And the IV start checklist is here for you. Again, this one is peer-to-peer. Okay, so we do ask that you take your peer evaluation role very seriously. I would just tell you, consider, right, that your feedback may help or hinder the person performing the skill from learning the correct technique, which they might be employing on somebody that you care about or love. So please make sure that you give them good feedback. You do not need to tell them whether they passed or they failed. You're simply noting whether they did each step and providing some feedback if they did not. And then you will just turn those into the timer when you're done. For the documentation pieces, we do have just kind of some brief forms that you will just fill out by hand. So we're not going to have you download the EMR and do that for this particular thing, but you will have a cardiac system and a respiratory system assessment to complete. And again, you'll just hand those to the timer when you're done. Okay, so note here, telemetry, we're probably not going to be using telemetry. So that's just going to be a no. You would obviously see the patches on the patient's chest and the wires if they were on telemetry. Now that's just going to be a no for us. Rhythm, you can just say whether it's regular or not. And then you're going to calculate their heart rate. You're going to listen and count how many times you're hearing their heart and calculate their rate per minute here in this blank. Cap refill. The cap refill is going to be the same for all extremities. You will have a QR code that you can scan to get the information about the cap refill time. Okay. Jugular venous distension. If you see it, it's a yes. If you don't, it's going to be a no. The skin temperature is also going to be the same for your extremities. You're going to have a QR code for that that will give you your information to fill out here. You're also going to have a QR code that's going to tell you about your skin color. Okay. Moisture noted, if it felt moist, you can click yes. If it felt dry, you can click no. Edema, you guys have probably seen that we have the edema wraparounds we can add to Apollo's legs. If you see edema, you'll click yes. If you don't, you'll put no. Okay. If you hear any abnormal heart sounds like a murmur or something like that, you will put that in this blank. And then you should be able to palpate the radial pulses and the pedal pulses. So you're going to document whether that feels like it's within normal limits, weak, absent, or bounding. Okay, for the respiratory assessment, you will be able to assess the breathing pattern and the breathing effort. For the lung sounds, Okay, I am always a stickler to say that you should listen to your patient's lung sounds from the back as well as from the front. However, Apollo does weigh 150 pounds, and so we're not going to roll him over 40 times on our OSCE day. So you can assume that your lung sounds on the front and the back are the same. You can just verbalize during your assessment that you would roll the patient over to listen from the back. Okay, but you will be able to assume that your lower lobes, which you would have to listen to from the back, sound the same as your upper and your middle lobes, and you can document that accordingly. If the pulse ox is on Apollo, click yes. If it is not, click no. If he is on oxygen, click yes. If not, click no. If he is on oxygen, you can click which form of oxygen he's on and how much he is on. If Apollo is coughing, you can determine whether you think it's productive or non-productive. If he is not coughing, you'll click none. If you don't see any sputum, you don't have to worry about charting in that box. If you see the incentive spirometer on the bedside table, you can click yes for incentive spirometer use. If you do not, you can click no. If you see that he has a chest tube, you can click yes. If you do not see a chest tube, you can click no. Okay, so those are essentially the key pieces that we are going to be evaluating you on. This operates very similar to OSCEs that you've had in other courses. Please make sure that you practice well, and we know that you guys will do a great job. Thanks for listening to this pre-brief.